Coronavirus. What is a coronavirus? Researchers first isolated a coronavirus in 1937. They found a coronavirus responsible for an infectious bronchitis virus in birds that had the ability to devastate poultry stocks. Scientists first found evidence of human coronaviruses, HCOV, in the 1960s in the noses of people with the common cold. Two human coronaviruses are responsible for a large proportion of common colds. Coronaviruses, CoV, are a large family of viruses that cause illnesses ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. A novel coronavirus is a new strain that has not been previously identified in humans. The name coronavirus comes from the crown-like projections on their surfaces. Corona in Latin means halo or crown. Among humans, coronavirus infections most often occur during the winter months and early spring. People regularly become ill with a cold due to a coronavirus and may catch the same one about 4 months later. This is because coronavirus antibodies do not last for a long time. Also, the antibodies for one strain of coronavirus may be ineffective against another one. Over the last 70 years, scientists have found that coronaviruses can affect mice, rats, dogs, cats, turkeys, horses, pigs, and cattle. Sometimes, these animals can transmit coronaviruses to humans. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Detailed investigations found that SARS was transmitted from civet cats to humans and MERS from dromedary camels to humans. Several known coronaviruses are circulating in animals that have not yet infected humans. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs, avoid close contact with anyone showing symptoms of respiratory illnesses such as coughing and sneezing. The novel coronavirus outbreak caused 2,800 deaths as of February 28, while approximately 83,342 cases have been confirmed. Types. Coronaviruses belong to the subfamily Coronavirinae in the family Coronaviridae. Different types of human coronaviruses vary in how severe the resulting disease becomes and how far they can spread. Doctors currently recognize 7 types of coronavirus that can affect humans. Common types include 229E alpha coronavirus, NL63 alpha coronavirus, OC43 beta coronavirus, HKUI beta coronavirus. Rarer strains that cause more severe complications include MERS-CoV, which causes Middle East Respiratory Syndrome, MERS, and SARS-CoV, the virus responsible for Severe Acute Respiratory Syndrome, SARS. In 2019, a dangerous new strain called SARS-CoV-2 started circulating, causing the disease COVID-19. How cough spread. Current understanding about how the virus that causes coronavirus disease 2020 spread is largely based on what is known about similar coronaviruses. Person-to-person spread. The virus is thought to spread mainly from person to person, between people who are in close contact with one another within about 6 feet, via respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouth or noses of people who are nearby or possibly be inhaled into the lungs, spread from contact with infected surfaces or objects. It may be possible that a person can get cough by touching a surface or object that has a virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way why the virus spreads. When does spread happen? People are thought to be most contagious when they are most symptomatic, the sickness. Some spread might be possible before people show symptoms. There have been reports of this with the new coronavirus, but this is not thought to be the main way the virus spreads. How effective does the virus spread? How easily a virus spreads from person to person can vary. Some viruses are highly contagious, like measles, while others viruses are less so. Other factor is whether the spread continues over multiple generations of people if spread is sustained. The virus that causes cough seems to be spreading easily and sustainably in the Hubei province and other parts of China. In the United States, spread from person to person has occurred only among a few close contacts and has not spread any further to date. There is still more to be learned. Cough is an emerging disease and there is more to learn about its transmissibility, severely, and other features and what will happen in the United States. New information will further inform the risk assessment. Symptoms. For confirmed coronavirus disease 2020 cases, reported illnesses have ranged from mild symptoms to severe illness and death. Symptoms can include fever, cough, shortness of breath. Researchers believe at this time that symptoms of cough may appear in as few as 2 days or as long as 14 days after exposure. This is based on what has been seen previously as an incubation period of MERS-CoV viruses. Prevention and treatment. Prevention. There is currently no vaccine to prevent coronavirus disease 2020. The best way to prevent illness is to avoid being exposed to the virus. However, as a reminder, researchers always recommend everyday preventive actions to help prevent the spread of respiratory diseases, including avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue when thrown in the trash. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Follow Home Cures TV's recommendations for using a face mask. Researchers does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases, including cough. Face masks should be used by people who show symptoms of cough to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers and people who are taking care of someone in closed settings, at home or in a healthcare facility. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Treatment. There is no specific antiviral treatment recommended for cough. People with cough should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support vital organ functions. People who think they may have been exposed to cough should contact their hair care provider immediately.